Good afternoon once again to everyone. Thank you for joining today's topic. I'm Rene and I will be presenting today on very simple topic. It's very short, won't keep you guys too long today, but it's really about how to stabilize your patient with limited resources. And I know for a fact that many of the community health centers and posts may not have every single item that we need to stabilize our patients. And so this training is specifically for you, the community health workers, and let's go right into it. And the first thing we want to go through is our objectives, right? The objective in terms of stabilizing our patients should be following the first one should be following the ABCDE approach. And we did talk about this a few months ago, and also known as the primary survey. So we already know what the A, B, C, D, and E stands for, but can anybody remember? Can anyone remember the what the ABCDE stands for?
Airway, breathing, circulation.
Mm-hmm. And anybody know what the D and the E stands for?
Mhm.
All right, we'll get into that in a bit. Not to worry. Um, what's also important before we stabilize our patient is to always get a full cycle of vital signs monitoring, which is quite important. Because if we don't do the vitals, we won't know if there's any changes going on with our patient, especially if they come in an unconscious state. And another objective is for us to use basic nursing skills and some very simple medication administration techniques. And you must be able to recognize when to refer a patient um, and how to refer a patient from your health post or district hospital or otherwise. Now, why do we want to stabilize our patients? Can anybody can anybody answer the question? Why would you want to stabilize a patient before transferring them to another hospital? All right, the very first is that you want to save a life. All right, you don't want your patient to die. That's for sure. I mean, our goal is to make patients feel better and to maintain a healthy lifestyle. So your first action matters a great deal because you're mostly the first you're mostly the first person that will have interactions with the patients when they come to your health post. And your goal should be to stay calm, especially in an emergency situation. Keep the patient alive until you refer the patient. And every small actions that you do buys time for the patient. So every little thing that you may think it's too little or not, you're actually making a difference in your patient's life. So always remember your first action is to save life. Your goal is to stay calm and keep the patient alive until you refer them, and even small action buy time for the patient. And that is why stabilization matters with each and every one of your patients when they come to your health post with a complaint that you definitely will have to refer the patient, especially if they come in the critical state. So we talk a little bit about the ABCDE, which is also known as the primary survey. We know A is for airway, B is for breathing, C is for circulation, D is disability or neurologic assessment, and that is basically assessing the patient's consciousness level of consciousness, and E is exposure. We'll get into a little bit about this in detail in a bit. And in terms of maintaining an airway, how do you think you can maintain an airway for a patient who comes in not breathing well at the health post? Could anyone answer the question? A
You
patient
could lift
comes. Go ahead.
you can lift the head a little.
Mm-hmm.
Right, but put the patient on the side.
Okay, great. So that's basically what we call the recovery position. So to maintain a patient's airway, position is very important. If the patient has difficulty breathing, you want to put them in the upright position or the high Fowler's position, which I'm sure many of you know, or in a 90-degree angle, right? So you can probably have them sit up and encourage breathing techniques. But if the patient is unconscious or you find them unconscious, the first thing you want to do is to put them in the recovery position. Do the chin lift or the jaw thrust, as Letitia just mentioned. And you also want to clear the mouth or the airway. You can either use a suction or you can use a clot or gauze to make sure that the airway is patent to encourage even airflow. I have an image here with the recovery position. You will not be able to see it, but on the presentation when I send it, you will see what the recovery position looks like. All right, it's very simple. When you put the patient in a recovery position, you don't leave them. You want to stay with them until they regain consciousness. And when you put them in this position, it keeps the airway clear and it prevents them from choking on their own saliva or any other obstruction they may have in the mouth that could obstruct the airway. We go on the breathing now. So we already talked about airway and we're on breathing. And we still want to emphasize on the position of your patient. So keep the patients in an upright position if they have any breathing issues, or if they are on the bed, you put them in the high Fowler's position. You want to loosen any tight clothing because that can also obstruct airway or breathing. Keep them in a calm environment. Do breathing techniques with them, such as forced lip breathing. Anyone know what forced lip breathing? It's a homework, right? You can look up what is forced lip breathing. And you can also encourage them to do deep coughing techniques. Um, and this applies to when you have no available oxygen, especially some health posts, or most of the health posts do not have available oxygen cylinder. So these are just some techniques you can use to help maintain the patient's airway and prevent them from deteriorating further. And definitely want to start with your referral techniques that you usually do. Would send your message into your region's group, inform your medical superintendent, nurse in charge, whatever the case, and start your referral process. I also have an image of the different patient positioning cheat sheet. And I'm sorry, you will not see it at the moment, but you'll see it when I send the presentation, right? So there's several different positions that you can use and several different reasons. So you'll see this in your presentation when I send it out. We're under C, which is circulation. And the goal in circulation is to do things like control bleeding. So if a patient is bleeding profusely, the first thing you want to do is apply direct pressure or dressing to the wound. Circulation not only has to do with breathing, with bleeding, but also for patient who comes with vomiting or excess sweating, they lose important electrolytes. So you want to keep them hydrated. So for example, for the kids, if they come with like severe vomiting, fever, because when they have a fever, they usually sweat a lot also. You want to give them the oral rehydration salt. And you can have this at your health post and it can also be made, right? Patients with really high blood pressure, you want to give them the oral antihypertensive, of course, under doctor's prescription. And you want to keep the patient warm. You don't want to keep them too cold because they can go into hypothermia. We don't want that, right? Once the patient is warm, they have a good blood flow. And in some patients, you can even elevate the legs if they're in shock. Everybody following so far? Am I going too fast?
It's
No.
okay.
Okay, perfect. I also have an image in how to help control bleeding. Now, there are three techniques that you could use. And always remember, you're dealing with body fluids like blood. You want to put on your personal protective equipment, such as your gloves. right? You want to put on your gloves first. You can use a shear or a scissors to help remove clothing to expose the area that is injured or to get a better assessment of the area that is bleeding. You can use something called a tourniquet, and that's for severe bleeding. That's, for example, if there's a patient with a severed artery, you want to apply a tourniquet, right? And it's only used on arm and legs, and you want to apply it at least 2 to 3 inches above the wound, right? You don't want to put it directly on a joint. You wrap it around a limb and you strap it securely and tightly. What is also important is to note the time that you started with the tourniquet. When you apply the tourniquet, the time is very important. All right, so it gives us enough time to hold the tourniquet in place because you cannot keep it longer than 10 to 15 minutes. I'm not sure if that time has changed for now, but I'll get back to you on that. The third thing you want to do is you want to compress gauze, and that's for patient, that's for wound that you can see. To stop the bleeding, you want to fill the area with gauze, hold pressure for 3 to 4 minutes, and then you want to wrap it with a bandage. You guys use the crepe bandage or the stretchy bandage. You want to apply that, and you always do your reassessment to make sure there's no blood, there's still no bleeding. For moderate bleeding, you can use pressure dressing, and that is basically you place a pad over the area and just wrap it with a gauze and leave it. And we going on the D, which is disability. When a patient comes to your health post with unconsciousness, the first thing you want to think about is they may have a brain injury, or think about the patient's glucose levels, or in common layman terms, the sugar levels, right? So you want to check for the patient consciousness. You can do it by calling them out, tapping them. Um, you want to check a patient's RBS, which is very important because some patients, when they come with hypoglycemia, they can come in an unconscious level. All right. If the patient have a seizure or fits, as we know it, you want to put the patient in the recovery position and do not place anything in the patient's mouth. I know back in the days we used to hear put spoon in the patient's mouth, put what else we put in the mouth? Tongue depressors. You don't want to put anything into the patient's mouth because it causes more harm than keeping the patient. You cause more harm when you do that. If the patient sugar level is low, you want to give them either honey or something sweet. A simple thing like a sugar water, right? We don't want to go too much into different medications for now because that would have to be given at a higher level in the health post, in the district hospital or so. Also have a image for convulsions or seizures. The same approach is using the ABCD again, always with airway, breathing, circulation, loosen any tight clothing. If the patient is on the floor, you put something to protect their head, and then you turn them in the recovery position. Stay with the patient until the seizure ends, until they're fully awake, and then you can start your other treatment. For exposure, which is E, you want to check the patient also for hidden injuries because a patient might come with a fracture, an open fracture to the right foot, but then you miss a very big bruise or some bleeding at the back of the patient, especially if they were involved in a motor vehicle accident, a bike crash, whatever the case, and they come with an obvious injury, but you missed out something important. And always keep the patient warm because you want to prevent hypothermia. When we talk about the full set of vitals, the first set of vitals that you do will give the doctor an idea on what to treat first. All right. So many of you have the Gale kit, and many of them come with digital devices to check the patient's temperature, pulse rate with the use of pulse ox. you may have to manually do the patient respiration for a full minute, and your pulse ox to do the oxygen saturation. Now, as much as the digital devices are as convenient and easy to use, we have to remember that, for example, if you use a blood pressure machine, we notice that we have an abnormal reading. You want to actually do a manual reading also to confirm. Because with the digital ones, any slight movement in the patient's hand, or if they're not sitting in the correct position, you can get an abnormal reading. So another way to look at it is if you have a patient coming um, with a fever, like a really high temperature, and you can feel them when you touch them that they're really hot, and they're trembling or they have ague. And when you check the temperature, you find that the temperature is normal with a gale or with a different. You want to try a different thermometer, right? If a patient has a fever, their pulse rate will be very high. You want to double check manually if you find an abnormal looking results on your digital pulse ox. Right, so always go back to your manuals just to make sure you get the correct reading to compare. And then you want to know what are the normal values for your patient vital signs. So for adults, the normal heart rate should be between 60 to 100 beats per minute. Anything under 60 beats per minute, we term it as bradycardia. Anything above 100 beats per minute is known as tachycardia. Our respiration rate for adults should be between 12 to 20 breaths per minute. Anything below 12 breaths per minute, we call it bradypnea, and anything above 20, we consider tachypnea. The normal blood pressure range should be 70 to 90 diastolic and 100 to 170, sorry, 100 to 120 systolic. So we all know in textbook that they say the normal blood pressure should be 120/80. But keep in mind that some patients who are hypertensive, their normal may differ, right? Or if most patients come and they usually have a low blood pressure, you want to put all those into consideration, right? So don't expect a patient's normal blood pressure to be 120/80 each time. But if they have any medical condition, you need to put those into consideration as well. The normal body temperature for an adult should be 98.6 degrees Fahrenheit or 37 degrees Celsius. Anything below 95, we'll term it as hypothermia. Anything above 104 degrees Fahrenheit is known as hyperthermia. A normal patient's oxygen saturation should be above 93%. Anything below 90% is known as hypoxemia or low oxygen levels. Right? So you must know these different values in order to determine when a patient's vital signs are abnormal. Pediatrics, they are totally different, and this is something that you must know as well. For respirating rate for a newborn should be between 30 to 50 breaths per minute. Normal heart rate should be 120 to 160 beats per minute. For infants, 1 to 12 months, your respiratory rate should be between 20 to 30 breaths per minute. Heart rate should be between 80 to 140 beats per minute. For toddlers and preschoolers, their respiration rate should be between 20 to 30 as well. However, with toddler, their heart rate should be between 80 to 130 beats per minute. At school-age children, respiratory rate should be between 20 to 30, and their heart rate should be between 70 to 110. For adolescents, 13 years plus, normal respiratory rate should be between 12 and 20, and a normal heart rate range is 55 beats per minute to 105. All right, so I have a scenario. A patient came to the health post with pneumonia, right? They have the fever, difficulty breathing, and they're coughing. The child is breathing really fast, right? You find that the chest walls going abnormal and you have no oxygen at the health post. Can someone tell me how you think you will manage this patient? Hmm.
Vital signs and then ambo bag.
Hmm. You want to put an ambu bag on the patient?
Vital signs, high Fowler's position.
Mm-hmm. You also want to stay calm, right? Children especially tends to tired out. They take some they take some more time before they actually tired out. So your goal is to stay calm, keep them calm as possible. Use your parents as much as you can because usually they'll be the ones with the patient. But you're right, you keep them in the high Fowler's position or the sitting position and keep them calm. Full set of vitals is definitely a priority, and you want to keep checking if the patient have a fever. You want to do your tip and sponging, basic nursing techniques, tip and sponging, keep the patient cool, remove the clothing, um, make sure you keep them hydrated, right? Because all of these things can, if you don't do it, can cause the patient to complicate more, and then you end up losing a patient, right? Activate your normal referral techniques that you'd usually do. You either consult your doctor via telemedicine, you seek assistance from your region, your RHO, your medical superintendent, whoever you contact to initiate a referral, right? And that is also if the doctor spoke to you and say, hey, give the patient medication and keep them, then you'll know how to manage the patient. But if you notice that the patient has a very low oxygen level with even the basic steps, then you know it's time to refer the patient, right? So these techniques is not something for you to do and keep the patient. They're mostly to stabilize before you actually do a referral. A next scenario is a patient came after having a motor vehicle accident. They fell off an ATV bike and they fell onto a stump, right? And they having a excessive bleeding from the leg, just above the knee. How will you manage this
Apply
patient?
tourniquet. Apply tourniquet.
Mm-hmm. All right. So before you apply tourniquet, you want to start with the basics first. You want to start, the tourniquet should be the last resort, right? You want to try to,
Vital signs.
yeah, vital signs, but you also want to apply direct pressure to the wound. Remember to put on your protective equipment like your glove or your gong and apply gauze to the area and just apply pressure. Right? That's
So
it
you're
usually
applying pressure directly on the wound?
yes, you're applying pressure on the wound. If that doesn't help, then you will need to consider the tourniquet. Right? But the first step should be to apply direct pressure to the wound. Make a consultation. I remember you when you're dealing with these patients, you must work as a team, and it's not only a one-man show when a patient comes, only one person doing all these things. You need to work together, delegate persons to do different things. So if a patient comes in front of you, four of you there, you can have someone do the patient vitals while you deal with the bleeding. If you have a higher level worker, maybe a nurse or a medic, so they'll know how to manage patients. They can set an IV access and give fluids, etc. But that is more, we don't want to get into that as yet. We just want to keep the patient stable enough before we refer them. Right? So I don't want to go too much into the excess or more in-depth management when you want to keep it as simple steps that you can do to help prevent complications. um, the next thing is when and how do you do referrals? Now I want to hear from you. Right? You have a patient and you spoke to the doctor and doctor said to refer the patient. What is the different step that you would take to refer your patients?
Good afternoon. So what I would do, I would talk to the patient, ask them what actually happened, check their vitals, um, do what I can for them,
Mm-hmm.
record the vitals on the referral, and give like a brief paragraph on what transpired, stop the referral, and then I'll get the patient out.
Okay, thanks. Um, for me, what I have here, when to refer patients are you refer patients when they're unconscious, refer patients when they have severe breathing issues, uncontrolled bleeding, if they have severe chest pains or they present with severe dehydration. And we will know this when we do a consultation with a doctor or if you know how to assess your patients. Right? But patients, especially with chest pains, and you're not sure, you do everything you can and it's still not, alleviated with medications, you want to refer the patients because it could be something more serious. How to transport is to keep them upright, especially if you don't have any oxygen. You don't want a patient to lie down on their way. You need to keep them upright in sitting position, especially if they need to get oxygen ASAP. If they are unconscious, you put them in the side in the recovery position. And in some cases, you may have to elevate the leg in some patients if you suspect shock. And we only know this if we have a consultation with the doctor to get further evaluations. And always remember to keep rechecking your vital signs, and documentation is also important. Any slight changes in the vital signs, you'll know how to address the same. And that brings me to the end of today's topic. If you have any questions, you can ask them now. If no questions, you can always post up in the group and I'll send the presentation in a bit.
Good afternoon, Rene. In our case, like when we was living in the interior, if something has to happen to someone, not here in the village, but way out in the bush, like 4, 5, 6 hours to go and see the patient walking on foot.
Mm-hmm.
In that case, like we wouldn't be a whole set of us to be taking vitals and stabilizing, and it would only be one person go and see that patient out in the forest, I would say.
Mm-hmm. Yeah, there's a
Yeah,
quite
so
it's a quite unique position. Um, on the field, it depends on the scenario that you're dealing with. You can do simple things to help to stabilize your patients as well before you transfer them out from there. Like
yeah.
you may not be able to do the vitals, the complete vitals, but I think you can still do a pulse rate. You can still check a patient's
Mm-hmm.
respiration at least. And then remember to always document that this happened in the fields and you don't have your requisites to check the patient. But then again, it's also good to prepare an emergency bag to walk with or an emergency kit, which should include your vital signs equipment, at least blood pressure, pulse, temperature, basic items, gauze. If you like, I could just come up with a list of things that you can keep as an emergency or a first aid kit to walk with when you go out on certain field trips.
Yeah. Yeah. Just letting you know.
Yeah, but that's really good point to note. It can be difficult, especially when you go into the fields and you don't have the resources. But really and truly, this presentation is for you at the health post. In some cases, it could happen out of the health post, but I just hope that some of us use our initiative to walk with, little extra things when we go on the fields, in the fields. Any other
Yeah.
questions?
Thank you.
No problem. Any other questions? All right. So just a reminder for tomorrow, we'll be starting with the ultrasound course. Tomorrow will be the opening session. So for those who signed up, and it's mostly for those who has an ultrasound at their site, um, I can extend an invitation to others, but you will not be able to do the full course in terms of the practicals and so on because you don't have an ultrasound. All I just a reminder for those we'll be starting tomorrow, so you can join on team meetings.
What time?